Hey, this is Dr. Alvin Philippos, and today we're going to be talking about methylene blue IV infusion, which I've got a lot of patients talking about. Hey, what is it? What can I do? Well, here at our office, we're pretty structured with methylene blue IV, and we've looked at oral drops over the counter and stuff, but prescription methylene blue tends to work the best, and our providers will help facilitate that. We do see that prescription oral works pretty good, but the methylene blue IV infusion, which is a simple dye, is a very good approach when you combine that with ozone therapy and EBOO ozone infusion or even 10 pass. So at Venturis Clinic, we tend to do that pretty good. So the idea is that methylene blue is a very powerful mitochondrial enhancer and an antioxidant. It's originally used as a dye and an antiseptic, but in our integrative medicine, we actually will do a methylene blue IV infusion. And what it does, it dyes a lot of these mitochondrial cells that are not healthy. And we follow that up with things like a photobiomodulation. We'll do things like ozone and kill off a lot of the microbials and things that may be suppressing your immune system. So, if you've seen some of our other videos, the biggest thing is to get a proper diagnosis before you get into these things, because we want to know what we're dealing with. So don't shotgun approaches with things like methylene blue and things like that. Although it's healthy and it's useful, we want to be a very structured type of treatment plan to see that we are getting the results we're supposed to be getting. So that mechanism of action is it enhances the mitochondrial respiration, bypassing the electron transport. So for your nurses and doctors that question, hey, I don't believe in any of this, there's actually research behind this. And the idea is that it reduces the oxidative stress and inflammation in the body. And the whole point is, especially recently after things like COVID, our patients that have cognitive dysfunction, early stage Alzheimer's, early stage dementia, and things like that. The whole point is your body's cellular structure needs ATP production for energy, and that cellular metabolism is key. And when we combine this with ozone and photobiomodulation and ATP infusions, we actually do IVs for ATP production. It is one of the best treatments we've ever seen, and our results are just getting better and better as we go through this. And the benefits for things like autoimmune diseases, people that suffer from lupus, rheumatoid arthritis, multiple sclerosis, Hashimoto's, chronic fatigue, long COVID, and even patients that have cognitive dysfunctions. If you can reduce that mitochondrial dysfunction, that inflammation in general, and just boost that immune system, these patients just come right out of it. And the synergy with things like ozone therapy is improving oxygen utilization. You're enhancing mitochondrial support, you're amplifying your immune support, you're detoxing, you're improving that fatigue and mental clarity, especially patients that have gone through long COVID and patients that have a combination of long COVID with other autoimmune, which is probably the most common thing that we see. Methylene blue tends to help the most, and we actually utilize things like a dark field microscope. Once they've uptaken the dye, we can actually see these cells under a microscope and see what it's doing before we do any type of treatment. So one of the main treatments that we offer is called EBOO, Extracorporeal blood oxygenation. It's a high volume blood ozone therapy. We actually can use 10 pass as well, which is a lot of patients that we think we can get away with that. That's what we offer. And it filters and detoxifies the blood, enhances circulation and immune function, and it's effective for very chronic inflammation and autoimmune conditions. So sometimes we'll do methylene blue, and then we'll also do curcumin and things like riboflavin to tag those inflamed cells, and you'll do a series of these treatments. But these aren't treatments that you have to do forever. A lot of times we'll do a couple weeks, we'll take a step back and let the body kind of handle its thing, and mast cell activation and things like that. You're just going to see this thing really kind of kick into high gear. So Methylene Blue and EBOO is the most integrated approach that we have, and it's rapid symptom relief, reduced inflammation, oxidative damage, improved energy and cognitive function, and long-term immune system support. Which is why at Venturis we really specialize in that integrative and regenerative medicine. I mean, we take the medical and the alternative side of it and we combine it together so that you've got all these practitioners looking at your case, and we've got state-of-the-art ozone and EBOO therapies, personalized methylene blue protocols, and expert care for autoimmune and chronic. And we're just dedicated to helping you heal, which is why we have people flying in. We have people from all over the place flying in because we structured this thing so it's affordable, and we get a very direct approach that we want you guys to see the best thing as far as results are possible. So you can visit us on the web at venturisclinic.com, or schedule just a 15-minute phone consult and let us just kind of talk to you and kind of see what's going on. Maybe this is right for you, maybe it's not, but at least we can steer in the right direction. And you can also just 405-848-7246. Talk to one of our assistants, and let's get you in, you and your loved one, and get you better. So we'll be seeing you soon.